Hey, good morning, section 3B, NCM 112, UC Con. Okay, so this will be, I think, the fourth and fifth disease that we will be studying. Today we will be tackling your phobias and PTSD. I hope most of you or all of you have already watched the video lecture that I made regarding GAD, Generalized Anxiety Disorder, and your anxiety disorder. Okay, and those will be part of your midterm exam. So we will be, I will be browsing through the midterm exam later and see if at least most of it, at least 75% of it, is in our lectures. If not, okay, we will postpone it next week. Okay, you do not have to worry about the exams. Importante is you learn, okay, and pick up concepts. Okay, exams can be taken on Canvas anytime, so we'll figure out the schedule for that. I was messaged by your classmate earlier, and he was asking regarding the self-awareness workshop. Okay, your schedule for section D, self-awareness, is on March 7 to 9. Okay, so it will fall under your duty dates. They are still trying to finalize if it will be in the auditorium or in the gym. So we are still finalizing. Uniform most likely will be your green pants uniform. Sweet. Okay, yeah. Most likely it will be your green pants uniform. It is important na naka-uniform kayo. Or I don't know if you will be wearing your, they will be allowing you to wear your ordinary clothes on the last day. Okay, para at least you will be more comfortable. We'll see. Okay, if Ma'am Magwilang, Ma'am Mitzi, and Ma'am Abby will propose. What else? But most likely at the end of this day, you will be having one CS regarding the 4 diseases already, or 5 diseases that we'll be discussing. Okay, so that madagdagan yung class standing activities nyo for midterms. Again, don't worry about the midterm exams. I know the other classes have started it already. I have finished it already. Just focus on, let's focus first on gathering concepts and finishing the topics that we need to finish for midterms. For today, we will be discussing phobias, PTSD, post-traumatic stress disorder, and the handout has been sent to you through the group chat. Yeah, actually, I have one video on phobias, pero medyo mahaba siya. Okay, so probably later we'll see what phobias are applicable to us or what are the most common phobias. Okay, in terms of phobia, okay, a more generalized term or a more medical term that we use in clinical psychology is specific phobia. Okay, specific phobia or simple phobia, the person experiences intense, irrational anxiety when exposed to a specific feared object, such as a snake, situation such as being in an enclosed space. Okay, so 2 keywords that you have to understand about phobia. Okay, the anxiety being experienced is intense. Okay, so you have your levels of anxiety. So this is around level 3 already. Or sometimes if the person feels that he cannot escape, there is no way to escape that situation, it can lead into panic level 4. Okay, the anxiety is also irrational. It doesn't make sense. Okay, so a common phobia is like snake, yung sabi dito. Okay, so what happens? Okay, we see a snake, we start shouting, we start running around, running away from the snake. Okay, without even thinking, is that a poisonous? Is it a big snake? Is it a small snake? Diba? So yun, it is irrational. Okay, unlike when we are crossing the street. Okay, mas dangerous pa yung mga, for example, yung mga jeepneys, yung mga sasakyan na dumadaan sa kalsada. But okay, although there is anxiety towards the anxiety towards the cars and jeeps is very minimal, that we still are able to think and process. Tatawid na ba ako? Is the jeep far away that I can still cross? Okay. Ano ba? Will the jeep slow down? Does it look like the jeep is slowing down as it is approaching me? So we still are able to process. But compared to phobia, once we are exposed to that stimuli, okay, there is panic and irrational anxiety and fear towards the object or situation. So as seen in the photos here, like the spider, okay, ewan ko kung ano to, okay, our fear na mag-develop tayo ng skin disease, okay. Exposure can take place either in real life, face-to-face, okay, it is actually in front of you, or through images, movies, television, photographs, or even just in your imagination. Even just by thinking about it, okay, people can have a phobic experience. Okay, they can trigger their anxiety just by thinking about it. So isipin mo lang yung spider, isipin mo lang yung snake, okay, you can feel the intense anxiety already. For many, the anxiety leads to avoidance. Okay, so iniiwasan mo yung object or place or situation. Or it can lead to a disabling behavior that interferes with activity. Or at worst case scenario, the person decides to confine himself at home. So ayaw niya nang lumabas ng kwarto, ayaw niya nang lumabas ng bahay. Okay, so that is severe anxiety already. Anxiety can also lead to panic levels, especially if there is no apparent escape from the feared thing or situation. So when do you see this? Okay, a panic level when during this COVID pandemic, when we are having our vaccinations. Okay, so meron yung mga tao na talagang sobrang takot sa vaccines, sa needle, okay, sa injection. Okay, so and sometimes there is no apparent escape kasi like for the kids, the last batch na nagkaroon ng vaccines are the children. So they apparently did not have an escape because their parents will hold them down, the healthcare worker will hold them down, okay, and it eventually leads to a child crying, okay, dun sa vaccination center, nagwawala yung bata. Okay, that is already your panic level because you cannot escape. Okay, so that is your panic level of anxiety due to your phobia. Okay, so yan, snakes. I don't know if some of you are cringing already with the visuals that I am showing. So, kita nyo dito. Siguro yung wife ko, pag nakita niyo yung visual na nilagay ko ngayon dito, mag-panic yan. Avoidance and panic attacks. Although adults with specific phobia realize their fears are irrational. Of course, pag mas matanda ka na, okay, it is easier for you to distinguish what is irrational. Okay, so it doesn't make sense. My fear is, sometimes they laugh about it, yung phobia nila towards one thing. Okay, but, okay, they still experience severe anxiety when facing the stimuli. Okay, even though if you are not facing the snake already, okay, ano nangyayari na natatawanan mo sarili mo. Okay, so you can laugh about it, you can talk about it. But when you are faced already, suddenly the anxiety shoots up again, okay, or a situation. According to DSM-5, okay, your Diagnostic and Statistic Manual, there are 5 main groups of specific phobias. Okay, so you can see here. Okay, so water, height, injections, yan yung mga common yung mga yan. So the 5 main groups of your phobias, we start with natural environment. So why is it under DSM-5? Okay, because again, it is a manual or criteria for them to be able to diagnose if you have that specific mental disorder. Okay, so they divided it into 5 criteria. First is your natural environment. So natural environment phobia will include your fear of heights, storm, water, excessive fear towards what do you call this? Natural events like typhoon, for example, mga yan. Earthquakes, okay? So those are natural environment. Second is your animal type phobia. Animals, insects, so marami insects. For example, takot sa ipis. Okay? Another level yung takot sa ipis na lumilipad. Okay, so a lot of you. Okay, so medyo level 2 anxiety pag nakakita ng ipis, pero pag lumipad na yung ipis towards you or towards anywhere, automatic magiging level 4. Okay, yung panic attack mo. Insects, what else? Okay, so yun, animal type, dogs, cats, okay. Snakes fall under that as well. The third classification is your blood injection injury type. Okay, so this includes needles. Okay, from our duty, I was able to bring home a 50cc syringe. Okay, so the ones you use to aspirate, okay, para bawasan sino ba yun? Si Emil. Okay, the one you used in aspirating to 250cc from the 500cc bottle. Okay, so inuwi ko yun. Okay, so it's this big, syringe this big. So sayang kung meron sanang needle na ganun ring kalaki, proportional to that, it would be a more interesting sana. Okay, pang skin test, ganang kalaki na syringe. Okay, so needles, invasive procedures, medical procedures. A good example of this is my father. Okay, so hindi siya we call this COVID vaccine because he was very afraid. So he has a severe phobia from needles. Hindi magpapa-injection yan. The reason also why he doesn't have a tattoo, kahit gustong-gusto niya magpa-tattoo. Yung mga anak niya may tattoo lahat. Okay, kahit yung wife ko may tattoo, yung sister ko may tattoo lahat, and inggit na inggit siya. Okay? Pero hindi siya makapagpa-tattoo kasi takot siya sa needles. Okay, so what happened? Because he wasn't vaccinated, he eventually developed COVID during the Delta surge. So that is a medyo malakas na variant, and he was hospitalized because of that. He spent 2 weeks in the hospital because of the COVID Delta variant. So what happened in the hospitals? Of course, anlitusok. He had different IV lines inserted in him. What we call this, medications were injected to him multiple times. Since he was in the hospital already and he had diabetes, okay, so he was trying to avoid insulin injections while he was out of the hospital. Pero pag nasa loob ng hospital, wala, since the doctor ordered insulin injections for him, okay, so he was having insulin injections twice a day, skin test, etc., etc. Okay, so almost in a day he would have attend. He became immune. He lost his fear of needles already. The first thing he did when I think 2 weeks after his confinement was he already went to SM para magpabakuna for COVID, and it felt like nothing. He even had he underwent dialysis, by the way. So they even had to insert a big needle, okay, sa one of the arteries and veins dito, like what happens in your dialysis. Those who went for dialysis duty in what they call this CHTG. So yeah, tubes everywhere, needles everywhere, that he lost his trauma already for needles. Okay, so a lot of us have phobias with medical procedures. And also, what falls under this is dental procedures. A lot of us are afraid of dentists. Okay, so my wife and my son, wala silang takot sa dentist. Actually, my wife took up dentistry bago siya naging nurse, and my husband, my son, okay, so as much kung pwede lang, every day and every week siya pumupunta sa dentists. Okay, what else? My wife always tells me that I am afraid of dentists. I tell her I am not afraid of dentists. I am afraid of paying the dentist kasi mahal ang mga dental procedures. The fourth type of phobia is your situational type. Riding airplanes, elevators, enclosed spaces. Okay, so yeah, because of the enclosed spaces in the elevators, become claustrophobic. So I haven't encountered people yet who are scared of enclosed spaces. Okay, but I have a cousin who developed a small phobia, or medyo anxious siya. There is a level of anxiety when he goes to escalators, because when he was around 8, 9 years old, was playing with an escalator in Maharlika. Okay, dati kasi when we were young, the escalators in Maharlika were still working. Okay, so now I don't think they turned it on already. But when we were young, the escalators there were still working. So what happened was, I think he was putting his shoe dun sa stair ng escalator. Okay, when it was going up. Eventually, pagdating dun sa taas ng escalator, when the stairs collapse, ang nangyari was kinain ng escalator yung shoe niya na he was jamming in the escalator. So what happened? Okay, when it started biting on his shoe, buti na lang he was able to pull his foot out the shoe. Okay, but eventually yung feet niya and the front of the shoe was eaten by the escalator. Okay, so rubber shoe kasi yun, kaya makapit. Okay, so since then, okay, kung he realized probably that if he was not able to pull off his feet, okay, na-crush na yung paa niya dun sa escalator. Okay, so since then, he has a level of anxiety when it comes to escalators. Fear of airplanes is a usual fear. So marami ang nagde-develop ng gusto ko mag-travel, pero takot. There is a level of anxiety when it comes to riding airplanes. My wife is very, what do you call this, yung take-off part, medyo yun yung pinaka natitrigger siya, na-irritate siya doon. When we were living abroad, my work allowed me to travel back and forth the Philippines every 10 weeks. So every 10 weeks, nakasakay ako ng airplane pabalik ng Pilipinas. Even my family, kasama ko yung family ko nagta-travel. So what do you call this, hindi nawala na yung anxiety ko in terms of riding airplanes, that once the airplane takes off, I can fall asleep doon pa lang sa take-off part. Okay, kasi the travel going to the airport, Baguio to the airport, medyo bugbog na yung katawan mo, tapos the waiting time in the airport is too long already, that once I sit down the airplane and when it takes off, I can sleep already. I know people na sobrang anxious, okay, even though they travel a lot, once there is a turbulence, yung kapag nag-shake yung airplane, they feel like they're going to die already. I think for me, wala. It's been a dabda experience. If it's gonna crash, wala kang magagawa. Parang gano'n na siguro yung mentality ko. So I can sleep the whole flight kahit mag-turbulence pa yan, kahit bumabagyo pa yan. Yeah, others. Choking, vomiting. I saw a video of this. The person has a fear of vomiting. Loud sounds. So my sister has a phobia on clowns. Okay, so yan ang paborito kong pang-asar sa kanya. Okay, because her fear or phobia of clowns. So yeah, what are your phobias? What are you afraid of? Okay. Phobia data, there are more common in women than in men. Okay, so women have more phobias compared to men. The onset varies. Okay, majority of phobias occur in the childhood or early adolescence, with majority developing a phobia before the age of 10. So you can see here, okay, usually sa dentist. Okay, I think the most painful experience in a dentist, of course, is the injection. Okay, pag meron ka anesthesia, the needle going to your gums, extraction of the teeth. Okay, it's very traumatic yan para sa mga children that they develop a fear of dentists. Sometimes also your phobia comes with a comorbidity. It means that you have a separate mental disorder, okay, that accompanies your phobia, like anxiety disorders, mood disorders, and alcohol dependence. Okay, let's try to differentiate what is the difference between fear and phobia. Fear is a common feeling experienced by everyone. Okay. In contrast, the phobia is a form of anxiety disorder characterized by excessive and persistent fear of objects or situations which may not carry real threats. Okay, so hindi naman, have you seen anyone who has died because of a cockroach? Wala. Kahit sa news, I haven't heard anyone dying because of a cockroach. But the fear of the cockroach is excessive. It is out of proportion compared to what really the cockroach can do to you. Okay? Anong sinasabi nilang ginagawa ng cockroach? Kuliti lang naman. Okay, sometimes you wake up with a sty on your eye, and I think that is the worst you can do. The cockroach can do. Going back to my father developed a phobia of cockroaches because when he was young, okay, so he was mahilig sa sweets yung father ko. So when he was young, condensed milk, the can of condensed milk, he was drinking, he was sucking on it. Okay, tapos while he was sucking, suddenly may naging crunchy part yung condensed milk. Then when he looked at it, there was a cockroach, okay, sticking out of the can of the condensed milk. And that is when he started his anger or phobia of cockroaches. Okay, naging crunchy bigla yung condensed milk that he was sucking on a cockroach already pala. Okay, and since then, galit na galit yan sa ipis. Okay, so fear and phobia. Fear can be felt by anyone when faced with an unknown or dangerous situation. A phobia will cause irrational fear that will consume most of your time and energy. So because the fight and flight response is triggered and it is triggered prolonged than usual, so there will be a sense of fatigue in your body. Fear is characterized by nervousness, anxiety, discomfort, and distress. But your phobia can cause tachycardia, shortness of breath, dizziness, nausea, vomiting, diarrhea, and even a panic attack. So I don't know if the video earlier I showed you was on panic attack. Okay, so again, they say that at least once in our lifetime we will experience a panic attack, and it is something that we wouldn't want to happen again. Fear does not need medical intervention, but when it comes to phobia, especially if it interferes already with our ADLs, with our lifestyle, okay, phobia needs medical help. Fear cannot be overcome by medical treatment, okay, so because it will settle on its own once the fear or the trigger or the threat, okay, is rationally not present already. Kumbaga wala na yung threat, okay, we know that we are safe already, fear will basically settle down. It can be treated with cognitive and behavior therapy. Okay? And at the same time, why does it say it cannot be overcome by medical treatment? Because it will happen occasionally. It will happen when it has to happen. Unlike phobia, okay, it can happen tapos hindi ka na makaiwas. Okay? That is the difference of your fear, rational fear compared to your irrational phobia. I think I have a list here of 25 most common phobias. Okay, so I listed 25 just for you to see what are the common phobias and what do you have. Okay, what are you experiencing? Okay, which among this are you experiencing? I got the source from the internet, so fearof.net. Actually, maraming lists in the internet of phobias. You have your fear of spiders, okay, which affects 48% of women and 12% of men. Okay, so meron ba ditong has fear of spiders? Kahit yung mga nasa toilet natin, yung tinatawag nilang balay, okay, gagambang balay. Okay, malalaki kasi yun, pero they are basically harmless. Okay, so I haven't seen anyone attacked by a gagambang bahay. Okay, so 48% of men, 12% of women. I had fourth-year students last year. Mga babae sila. They were a group of 2 students, magka-dorm mate kasi sila somewhere in Brookside, and they were taking care of tarantulas. Okay, their tarantulas came from meron pang galing abroad and everything. It was costing from sorry, the most expensive that they had was I think 10,000 pesos na tarantula. Okay, so yeah, and I wanted to start pero hindi na rin I was not able to get in touch with them already. So, and I don't know if I will be able to really take care of a spider na hindi mo naman pwedeng hawakan. Okay? So, the second, according to the list, is the fear of snakes. Okay? Phobics avoid certain cities. Phobics avoid certain cities because they have more snakes. So if you talk about fear of spiders and fear of snakes, one country I think you have to avoid is Australia. Okay, so yung anak ko, when we talk about phobias, okay, and spiders and everything, so we can't go to Australia, okay? Kasi because of the black widow spider, etc., etc. Yung mga tipo. Fear of heights, 5% of the general population suffer from this phobia. Okay, so a lot of men experience a electric sensation when there is fear of heights. Okay, so I don't know what women feel when you are exposed in height. Nung nagbibiyahe kayo sa Atok, okay, I don't know kung nag-stop over kayo and took your pictures dun sa highest point of the national highway. Okay, tapos yung view doon was really spectacular. Medyo mataas ka nga talaga compared to the when your first time to go to Atok, yung road na dire-diretso going up, then suddenly you're on top of the mountain already before you even reach the highest point. Okay, that is a really mararamdaman mo talaga na you are on a very high point in the Philippines. Agoraphobia, a fear of open or crowded spaces. And it is not just an open space. It can be an open space, a wide space filled with a lot of people. Okay, so that is a combination of two factors. It should be a wide space, and the wide space can be full of people. Like for example, yung mga soccer fields natin na puno-puno ng tao, your malls. Okay, so people have fear of that. So that is, so I think, yung nasa picture. Yung daming tao tapos it's a big space with a lot of people. Okay, Cynophobia. Okay, so you can see here one of our passion, dogs. So this is my son. Okay, so takot ka sa aso, I don't think you will be able to approach my son during this situation. Okay, or if you see me in the park and I have these two dogs with me and you have Cynophobia, I don't think you will approach me as well. Okay, so there are people who have developed fear of dogs. Okay, and as you can see here, my family is the opposite. Okay, we are addicted to dogs. This is my daughter. Okay, yeah. Okay, Astrophobia, fear of thunder, lightning. Okay, also called Brontophobia, Tonitrophobia. Okay, so mostly this is for children, di ba? Claustrophobia, fear of small spaces and elevators. I felt this claustrophobia when my father was confined for COVID, because before we transferred to a private room, we were asked to sign a consent that we were not allowed to leave the room until ma-discharge kami because COVID nga. Okay, so the fear of being able to leave the room for 2 weeks, when I entered the hospital room, I felt claustrophobic. Okay, no, talagang nag-increase yung RR ko. I felt I felt that I was palpitating. Okay, so I just needed to calm myself and relax. Pero I really felt claustrophobic at that time, realizing that I will be in that room, okay, for 2 weeks, most weeks, or at least 2 weeks, parang gano'n. So I felt claustrophobic. Yeah, once you reorganize the room, once you're able to open all the windows, tapos sa Benguet Gen, of course, yung room na nakuha namin had its own parang veranda na maliit. Okay, tapos medyo maaliwala. So eventually nawala yung fear, yung claustrophobic, yung claustrophobia na naramdaman ko na. Mysophobia, a fear of germs, especially once you finish your what do you call this, microbio. So for your batch, I don't know how you did your microbio online. Pero yung batch kasi namin, our microbio was really done sa laboratory. Every day you're with Petri dishes. What do you call this? There is culturing of bacteria, smearing, everything. Tapos after 3 days, makikita mo ganito yung itsura nung bacteria na iniswab mo from the table, bacteria na iniswab mo from the doorknob. Okay, it is this color. And then you will also, during our time, we were asked to swab a lot of things. Swab the toilet bowl, swab your ball pen, swab your wallet. Okay, tapos you will culture it sa Petri dishes. Tapos after 3 days, we go back to the Petri dishes. Ganito karami yung bacteria na from the bacteria that came from your ball pen, that came from your wallet. Okay, and I think a lot of us in our class developed a bit of mysophobia. Okay, so mandidiri ka, gusto mo linis ka ng linis palagi. The germs, we swabbed under our fingernails. Okay, tapos ini-swab namin. Then we realized that there are different bacteria present in the fingernails. Even the spoon. Okay, of course, one of the dirtiest parts of our body is our mouth. Okay, kasi maraming bacteria dyan. So we even swab that. Tapos we even swab our spoons. And that's where we realized, kaya pala hindi ka pwede mag-double dip. That's the reason why you need a serving spoon. O kunwari yung mga palaman natin, yung nadilaan mo na, tapos ibabalik mo doon. Okay, basically the bacteria will multiply in that. We were able to swab. Okay, naglagay kami ng spoon sa mouth namin, then we swab that, and then we put it in the Petri dish. Okay, so nakita namin kung gaano karaming bacteria yung nag-multiply. Okay. Aerophobia, fear of flying. 25 million Americans share the fear of flying. Why? Because, of course, the fear of the airplane crashing. Okay, but if you understand the statistics, okay, mas marami pang car accidents instead of plane accidents. There are more people who die of car accidents compared to the people who die because of airplane accidents. Okay, and yun nga, sabi ko, the reason why I don't have aerophobia is because it's something that you cannot control already. Nandun ka na sa langit, nandun ka na sa air. So if it crashes, wala, you really die. So let it go, parang ganun siguro sa akin. When you search the internet, I don't know why this picture keeps on coming up. And even in Facebook sometimes, I think naging popular to. Okay, a lot of people were trying to imitate it. I don't know what, they put rugby on their hands or glue or epoxy. Pero this is Tonitrophobia, the fear of holes. So we have, para kasi siyang holes na pinaglalabasan ng maggots, di ba? Kaya I think naging uso to. Tapos they even have GIF images where these are moving, the holes are moving, or there are insects coming out of it. Okay, so Trypophobia. Common fear, the fear of cancer and the fear of... Okay, people with this develop extreme diets. Okay, those who are afraid of cancer or a relative died of cancer, nagiging praning sila, they become paranoid. Okay. Fear of death, I think everybody has this, but others develop a phobia of it. Okay. Even talking about death can be hard or fearful for them. Glossophobia, the fear of public speaking, not being able to do speeches. So a lot of us have this as well for reporting. Okay? So pag reporting in class, sige, ako na lang gagawa lahat, ako na lang magsusulat lahat, ako na lang bibili lahat. I'll buy all the materials, I will do all the research. Basta, I don't want to be the reporter. Okay? So probably in your self-awareness seminar, okay, yung may glossophobia, I will ask you to talk in front. Okay, so hindi ko gagawin yun. Kasasabi ko pa lang, meron na sa inyong kinakabahan. So no, I won't ask you to do that. Monophobia, the fear of being alone while eating, even while eating or sleeping. Yeah, I think meron akong kilala na ganito, si Jeyo. Monophobia, fear of being alone even while sleeping. Okay, so my youngest brother-in-law has this. Okay, so he has a difficulty. Even my wife actually minsan has this, the difficulty of sleeping alone, okay, because of circumstances in the past or parang ganon. Okay, fear of failure. Okay, so a lot of our classmates, okay, who are what do you call this, who have high standards because there is fear of failure because of what? For example, the demands of the parents, their demand on themselves, their plans for the future. Ornithophobia, fear of birds, fear of chickens, fear of crowds, fear of intimacy, being touched and being loved, okay, and fear of needles. I used to fear needles. Okay, that and death. Fear of people, being afraid of situations. Aquaphobia, fear of water. Okay, so this is my son. Okay, we do swimming. So definitely we don't have aquaphobia. There are people who are very afraid of water because they don't know how to swim, probably, or because of a traumatic experience. Autophobia, fear of abandonment, being abandoned by someone, okay, which is also linked to gamophobia, fear of commitment. Kaya meron akong picture dito ni Ted tsaka ni Clifford. Okay, biro lang. Okay, so yan yung mga fear of commitment and fear of abandonment. Okay, so hindi, joke lang yan. Joke lang. Okay, so wala, mga ano yung mga yan. Loyal yung mga yan. Okay, specific phobia causes. There is no general or specific cause. So just like a lot of diseases, especially your mental disorders, okay, the cause is unknown. Okay, phobias seem to run in the family. Okay, so if your relatives have phobia, okay, genetically you are predisposed or in a disposition to have a phobia as well. If you talk about the neurobiological factors, according to science or according to tests, phobias can be caused by a hyperactive amygdala. What is the amygdala? It is in charge of processing emotions, memories, and fear. And another part of the brain can be abnormal in size is the insula, okay, which also processes emotions. Other factors in developing phobias. Okay, so experiencing or witnessing a traumatic event. So you call this your direct conditioning. So once you experience a traumatic event, okay, it can be phobic for you. Okay. Repeated warnings of danger about the feared object or situation. So as children, laging sinasabihan, huwag kang pupunta dyan kasi may ahas. Huwag kang pupunta dyan kasi delikado, baka mahulog ka. Okay, so what happens if there is always a reminder of that? What else? Don't go there because the police will get you. So what happens? The child develops phobia of police officers, phobia of snake, even though he hasn't seen one yet. Okay, there is already a conditioning that those are dangerous. Okay, so repeated warnings of danger, okay, can help you develop phobia when you grow up. Panic attacks when exposed to the stimuli. Disgust sensitivity. So developing disgust even before encountering the phobia. Like blood, for example. Some people are disgusted with blood. So that's why they don't like to have medical procedures. Anxiety sensitivity. Believing that the stimuli is dangerous and harmful, okay, can cause you to develop phobia. Increased attention biases and perceived threats. Okay, so for example, hindi mo pa nagiging clinical instructor si Sir Erwin or si Ma'am Joanne Bautista, pero based on the what do you call this? Based on what others have said. Okay, so wala, terror yan. Okay, papaiyakin ka niyan in the hospital, etc. etc. Papauwiin ka niyan from the duty, etc. So what happens? There is a bias even if you haven't yet experienced the clinical instructor, and there is a fear already of the teacher even though you have not experienced the stimuli yet. You can also have role models in fear. So as I said, if your family members have the phobia, okay, the patient can learn, especially during his or her childhood. Okay, pag laging sinasabi ng parent, okay, or the family member has a phobia towards an object or an event, okay, so laging umiiwas, what will happen? The child can develop and learn, okay, because of the programming or what they call it, the conditioning, okay, that the child is receiving. So what happens when someone has phobia? There can be a suicide risk. Individuals with specific phobia are 60% more likely to make a suicide attempt, okay, compared to individuals without the diagnosis. Why do they commit suicide? A combination of depression, okay, and of course they become tired of being afraid. You always hear that, pagod na ako being scared pagod na ako being anxious. Okay, so that's why they sometimes get frustrated. Okay, I am tired of being afraid. I'm tired of being anxious. Okay? So they commit suicide, or they attempt suicide. Signs and symptoms. The patient experiences severe anxiety when faced with the feared object or situation. The individual routinely avoids the object of the phobia. Okay. What else are the signs and symptoms? The person may have very low self-esteem, a feeling of weakness. He feels like a coward and is ineffective. Okay, so there are things that he cannot do, okay, that are blocked because of the phobia. Okay, so there are probably things at work that he is not capable to do because he is afraid of talking. Okay, like for example, facilitating a meeting, okay, or interacting with other people, okay, going to specific places, hindi siya mautusan because of the phobia. Specific phobia diagnosis. Okay, as I told you, okay, we are not able to diagnose, okay, because this is the duty of the doctor or the psychiatrist to diagnose. But okay, for you to know, of course, DSM-5 to diagnose, the criteria for diagnosis will be in DSM-5, Diagnostic and Statistical Manual 5th edition, provides diagnostic criteria for specific phobia. Okay, so nandito lahat to, but you will know the details, but you cannot diagnose yourself. Kasi diagnosis, doctor pa rin magsasabi. So there should be unreasonable excessive fear. Unreasonable, okay, it doesn't make sense. It is not congruent to reality, and it is excessive. It is too high. It is not congruent to the level of the stimuli. Okay. The person exhibits excessive or unreasonable, persistent, intense fear by a specific object or situation. There is an immediate anxiety response. The fear reaction must be out of proportion to the actual danger. Appears almost instantaneously when presented with the danger or situation. So being presented with a cockroach, yung level of fear na pinapakita niya is like someone is pointing a knife at him or a gun, for example. There is also avoidance or extreme distress. The individual goes out of their way to avoid the object or situation or endures it with extreme distress. It is life-limiting. The phobia significantly impacts the individual's school, work, or life. Okay? There is also a duration. So 6 months, it is chronic. Okay? Continuous. In children and adults, the duration symptoms must last for more than 6 months. So even if I keep on showing you the stimuli, okay, even after 6 months, you are still afraid of it. Not caused by another disorder. For example, the patient is not having hallucinations. The patient is not schizophrenic. Okay, so hindi siya na what we call this, like for example, if you have a patient who has hallucinations due to schizophrenia, na nakakita siya ng snakes, even there is no stimuli. Okay, so that is not phobia. That is already a false belief. Many anxiety disorders have similar symptoms. A doctor or therapist would first have to rule out similar conditions such as OCD, separation anxiety, schizophrenia, okay, before diagnosing it as a specific phobia. Since it is a mental illness, you have your treatments. The first line of treatment, okay, for the 2 diseases that we will be discussing today is CBT. What is CBT again? Cognitive behavioral therapy with exposure treatment. So talk therapy, psychotherapy, okay, conditioning therapy, and exposure to the stimuli. Successful treatments involve desensitization, so gradual desensitization. We talked about this already. Exposure therapy, in which a mental health professional, okay, your nurse, your psych nurse, your doctor, or your therapist, okay, in a mental health professional and exposure therapy, in which a mental health professional, okay, kaya nga your nurse, your doctor, and a trusted companion, siguro your best friend. Okay, the nurse and your best friend will accompany, or your mother, accompany the patient and gradually expose the patient to the feared situation. Okay, so what can you see here? For example, this person is afraid of the shopping center. Why is the person afraid of the shopping center? Probably he's thinking na madaming germs, there are a lot of people, or the open space, what else? There can be someone there who can harm him. Okay, so what will happen? He will be accompanied by a mental health professional and a trusted companion. And unti-unti, okay, here it goes. That's what he says here. So they will try to go inside the shopping center. Exposure to snakes, for example, unti-unti. But of course, you don't encounter snakes naman your whole, even in a week, in a day. Okay, so hindi. Unless probably you want to go to a country with a lot of snakes. Spiders here. So there is gradual desensitization. Merong initignan niya mga spiders in a bottle. Yung pala, there is a giant spider behind him. Applied tension technique is a strategy developed to prevent fainting, okay, or help people recover fast if they do faint. So what is happening in applied tension technique? So I think when I looked this up in the internet, we've been doing this for patients who are afraid of needles or being vaccinated or injections. So what is happening here is this technique involves tensing your muscles in your body, which then raises your blood pressure. If your blood pressure increases, you are less likely to faint. Okay, so for our patients who are very, what do you call this, developing panic attacks already, okay, when it comes to being injected. Okay, so kabaliktaran at what we're doing. Usually, if our patients are not really anxious, we tell them to relax. Okay, so lilinisan ko lang po, explain the procedure, put up your sleeve, we will clean it, then relax lang po kayo. Okay, for our patients who are already experiencing a panic attack, okay, almost magwawala na, we do the opposite. Okay, when we are drawing blood, when we are injecting, for example, or doing a skin test, for example, okay, so opposite, if kung nagpapanik sila. Okay, we want them to tense the muscle. Okay, sige po, tigasan niyo yung muscle niyo. Okay, tigasan niyo yung muscle niyo, breathe in, instead of having a soft abdomen, okay, tense up your abdomen. So what happens is it raises their blood pressure and they are less likely to faint. So opposite nung relax po kayo. Okay, so sige po, tigasan niyo po yung abdomen niyo. Tigasan niyo po yung leg muscles niyo, tigasan niyo po yung arm muscle niyo. Okay, so to avoid them from fainting. Also, treatment includes relaxation, breathing exercises. Thought stopping can reduce anxiety symptoms. Excuse me. Breathing exercises was discussed dun sa isang video na pinakita ko sa inyo that I shared to you yesterday. Okay, so try to see there what were the pointers that I gave for breathing exercises. Role playing is also important, and guided imagery. So guided imagery, I talked about this in the lecture for anxiety disorders. Okay, so it tells you about what to think. Okay, so let's talk about the beach. What do you see? Let's feel your feet on the sand, close your eyes, holding a coconut, etc., etc. So when you are doing role playing, okay, this parang return demo. Okay, so it teaches the patient what to do when confronting or when being in that situation. So when you see, when you're in the airport, okay, so practice tayo, okay, dito sa bahay or dito sa mall. Okay, so para pagdating natin dun sa airport, you don't tense up or you're not too very anxious already. So yeah, it is basically your return demo. Okay, so that is what you do in role playing. So once you practice it, the next time, or you continuously or multiple times practice the situation, when you are in the situation already, mas less yung anxiety ng patient. Okay, treatment includes pharmacologic treatment, but according to the books and research, psychotropic medication in both isolation or in combination with psychological treatment does not lead to improvements in a specific phobia. So it is unnecessary to give medications for a person with phobia. Although there can be augmentative medication. The augmentation is the common strategy for treatment for resistant depression. It consists of adding medication with a different mechanism of action to the therapeutic regimen. So ano lang, kumbaga, if it is not really helping, okay, let's try to do it medication with therapy. Okay, so what will happen? You give medications to treat the other symptoms of the phobia. You cannot treat his fear, okay, but through medications, I can treat the anxiety. I can treat the increased blood pressure. I can treat the palpitations. Okay, so I can give relaxants. I can give lorazepam. I can give Zoloft. Okay, so those are the things. Okay, but they are augmentative medications. They don't really treat the specific disease, but they can alleviate the symptoms, the extreme nervousness. Nursing interventions for your clients with phobia, specific phobia. Encourage the patient to discuss the feared object or situation. Okay, so let the patient verbalize her concerns, because talking about the trigger, okay, further exposes him to the trigger, thus mas nasasanay siya. Okay, so remember, sometimes phobia can be triggered even without being in the actual place or seeing the actual snake or seeing the actual spider. Sometimes even if they just talk or think about it, the anxiety level rises already. So gradually, we are telling them to be exposed to it just by talking about it. So unti-unti nasasanay rin sila, and hopefully the anxiety lessens the more they talk about it. Collaborate with the patient and the multidisciplinary team to develop and implement a systematic desensitization program in which the patient is exposed to the feared object or situation in a controlled environment. Okay, so it is a scheduled, it is a controlled environment once we are going to expose the patient already to the stimuli gradually. So you can start pictures muna sa internet, and then for example, after a picture in the internet, printed pictures naman, okay, actual pictures that he can hold, okay, then videos, okay, tapos unti-unti, let's go to an area, let's go to the zoo, okay, hindi tayo lalapit, okay, and then unti-unti, hinahawakan niya na yung mga feared animals na that is causing her phobia. Teach the patient assertiveness skills to help reduce submissive, fearful responses. Such strategies enable the patient to experiment with new coping skills that haven't been tried or that haven't worked in the past. Okay, you teach your patient and you make him, you fill him up with a realistic or reality. So one thing that I say, for example, to my children that are afraid of cockroach, okay, so or a spider or an insect that they see. So I tell them, which is bigger? Okay, which is bigger, you or the cockroach? So they will say, okay, so who should be more afraid? Okay, yung cockroach ba or ikaw? Okay, so dapat mas matakot yung cockroach kasi kaya nga tumatakbo yung cockroach kasi it is threatened already. You can just step on it. But can a cockroach step on you? No. Okay, so that is some realistic things that you can tell your patient. Present them with reality. You can go to the internet and show them that the gagambang balay, okay, hindi naman nakakamatayan. It is not poisonous. You can go to the internet and help your patient distinguish what is a poisonous snake and what is not. Okay, and the more usually you have a quote on that. Okay, fear is usually coming from ignorance. So if you do not understand it, you will fear it. Okay, so if you understand something better, okay, the less you will fear it. Understanding which snakes are venomous, which snakes are present in the Philippines. Okay, meron bang what do you call this? Meron bang anaconda sa Baguio, okay, or in this region? Okay, so are there really black widow spiders in Baguio or in the Philippines, or are they specific to Australia only, or in the United States. Okay, so once you research more about it, you will understand that it is irrational. Bakit ako natatakot sa black widow spider? Wala namang ganun sa Philippines. Okay? Instruct the patient in relaxation and thought-stopping techniques. You have done this already. The rubber band on your wrist, or visualizing the stop sign. Okay, so ito yung ginagawa nyo. Okay. To increase the self-esteem and reduce anxiety, explain to the patient the phobia is a way of coping and protecting the self from anxiety. Okay, so because you have already understood the concepts of ego defense mechanisms, for example, you understand that the ego defense mechanism is the protection from the self. So in a way, it is like normal to have a phobia or fear of the object because it is protecting your body. So let your patient understand that the fear being experienced is normal. It is a normal response of the body. Everybody experiences fear when being exposed to something that is threatening. The only thing that is a bit out of tune or abnormal is that the level of fear is too high for your patient. Okay? Normal palang matakot. Ang abnormal sa akin is yung intensity of fear that I am feeling. Okay? So it increases his anxiety. Okay, so everyone, he will feel that everyone is afraid in a way. Everyone is afraid of spiders or snakes in a certain level. Okay, yung akin lang medyo mas malala. Administer medications as ordered if there are anxiolytics, most likely. So you will see here. So talk therapy. Here you can see that since you know that the patient is anxious compared to others, so there are more people attending to the patients, 2 healthcare professionals instead of 1 just giving the medications. Okay, would you like me to hold your hand? Would you like me to hug you? Okay, or would you like me to assist you? Okay, so that is what is happening in this photo. Okay, so that is your phobia. Again, if you have any questions, okay, feel free to use the chat box. If there is anything you want to share, feel free to use the chat box as well. Before we go to the next disease, which is PTSD, okay, probably we'll have a 5-minute break, okay, for you to get your breakfast or whatever, and I will be playing a video also, okay, about phobias as we are going through this break. So try to see in the video which phobias are applicable for you and how common the phobia is. Okay, so what phobias were applicable for you in that video? And fear of colors. Okay, yeah, the fear of Fortnite. That's crazy daw, sabi ng anak ko. Okay. So next disease that we will be discussing for this morning is your post-traumatic stress disorder. And when you talk about post-traumatic stress disorder, the first thing that comes to your mind is soldiers. Okay, so yeah, if we talk about PTSD, the first thing that comes to your mind are the soldiers who were traumatized by war, what they see or what they experience during war events. And war is happening now in Ukraine. So madadagdagan na naman yung mga PTSD patients. So after the war, mataas ang demand and hiring for psychiatric nurses in Ukraine. Okay. Okay. Post-traumatic stress disorder is considered a trauma and a stressor-related disorder. So there are two factors that we will be talking about here. The event and the stressor, both causing the PTSD in the patient. So as I said, usually na pinag-usapan natin, or the first thing that comes to our mind when we talk about PTSD are soldiers. Okay, what they experienced, what they saw, okay, everything that they were able to encounter during the war encounter. There is a close relationship between anxiety disorders and PTSD. Okay, it is very close. Okay, however, there are marked differences when it comes to the diagnosis. There are a bit differences. Okay? PTSD can occur after someone experiences or witnesses a serious traumatic event. So aside from wartime or combat, okay, PTSD can also come from a natural disaster, earthquakes, for example, those who were trapped in buildings, those who were trapped in floods. Okay, a traumatic experience can also be rape, murder, or childhood sexual abuse, or persons who were tortured. Okay, so for example, yung mga prisoners in our jail cells, okay, na ina-abuse, okay, or those who were abused by fraternities, etc., etc., or mga gang wars. Yan. Those can be traumatic events. The disorder is characterized by, okay, nightmares can already be scary for us, but in PTSD, it is persistent nightmares. So almost every night or every time the patient falls asleep, there is a persistent nightmare. Recurring flashbacks. Okay, so your thoughts, okay, bigla mo na lang naiisip. You suddenly have thoughts regarding the event. Intrusive thoughts or thoughts that are disturbing. Hypervigilance. So you are paranoid. You keep on looking around, for example, or you are very cautious of the places you are going to and very vigilant of the people, the situation. Okay. There is also sleep disturbance along with the avoidance of reminders related to the traumatic event. So you want to avoid places, pictures, persons who were with you. Traumatic event. And remember, if there is sleep disturbance, okay, your body almost doubles or triples the anxiety that it is feeling. Okay, same when you are having your duty for the night duty. Okay, 3 days lang yon, but you already feel that what your body or your brain is already like shutting down or very weak because of the how many days that you were not able to sleep properly. But in this disorder, it is continuous. So almost every day the patients are having difficulty getting enough sleep. In the pictures, you can see here, these are already healthcare workers. So they have been in the peak of our pandemic, di ba? So they have experienced or they have witnessed a lot of people dying, a lot of people being intubated, a lot of relatives who were melting down, okay? A lot of grieving relatives, okay? So that can also cause post-traumatic stress disorder. Also the stress that they were experiencing, okay, when handling patients, how many hours inside the hospital, then they cannot go home to their families. Remember the peak of our pandemic, diba? tapos they were just sleeping in the hospitals. They can go home because they tested positive. And during those times, we didn't know too much yet about the virus. Okay, there were no vaccines yet. So just like for you also. Okay, so like now we are very comfortable. Okay na ako, basta I am vaccinated already. I am wearing my mask, social distancing. But during the beginning of the pandemic, it was very traumatic, especially those who were in the front line, our nurses, our doctors. And if you look now in the internet, okay, there is already PTSD, okay, because of pandemic, because of this pandemic, okay, and most affected are the healthcare workers. So not only soldiers. Life impairments can be mild to severe. Okay. Those with PTSD are irritable, anxious, fatigued, kasi they're always tensed and they have difficulty sleeping. They can be forgetful and they can be socially withdrawn. Post-traumatic stress disorder, those who survived a catastrophe of war that took many lives feel guilty that they are still alive. So it can be a survivor guilt. Okay, we call this a survivor guilt. Okay, I should have died with my friends, or I saw my partners, okay, or my teammates die in the war. I should have been there with them. I should have been the one who jumped in. Okay, para ako na lang yung tinamaan ng bullet, or I should have been in that area too when the bomb exploded. Okay, so yeah, that is called your survival guilt. Or in a catastrophic situation like a calamity. Okay, so for example, the father was not at home because, what do you call this? Because he was at work. Okay, tapos yung bahay nila tinamaan ng flood, nasira yung bahay nila, everybody died. Okay, so I should have been there with my family to protect them, etc., etc. So that is your survivor guilt. Patients with PTSD, high risk, 80%. Okay, so that is a very high risk in developing anxiety, mood, and substance-related disorders. Very high because as we already seen in some of the videos, the people fall into substance disorders, especially alcohol. Why? Because they want them, it helps them sleep. Okay, but the problem with alcohol intoxication is that when you wake up after sleeping, the alcohol can still be in your system. Okay, so you don't really feel refreshed. Iba yung gising mo from a normal sleep, normal complete 8-hour sleep, compared to even if you're drunk, you fall asleep for 8 hours. When you wake up, it's a different feeling. May hangover ka, mabigat pa rin yung ulo mo. Okay, because alcohol is still in your system. It is still a depressant, it is still a downer. Okay, so you wake up not feeling energized. Okay, so that is the problem with alcohol. But 80% of those who have PTSD develop anxiety disorders, mood disorders, and substance-related disorders. Okay, for example, drugs. They can start having drugs because they feel better. Okay, when they take in illegal drugs. So ang taas nun, 80%. What are the causes of PTSD? Okay, let's go first to the picture. Mental health problems, trauma, stress, genetics, okay, high levels of stress hormones, adrenaline, depression, brain injury, corticosteroid imbalances, severe anxiety, sexual violations, rape, sexual assault. Okay. Most PTSD victims are war veterans. This is a myth. Okay. So it is around just 8% yata. Okay, 8%, or we'll see the stats later. Okay, but not most PTSD victims are war veterans. The reality is PTSD is more prevalent in females than in males across the lifespan, because it is in females, a lot of females experience traumatic events as well. Okay, and their PTSD is linked with rape, sexual molestation, physical attacks, threatened with a weapon, for example, yung mga na-hold up, nanakawan, okay? So, yan, yung mga physical attacks. Being bullied in school, for example, okay? Women and men, childhood physical abuse, assault. I don't know if when we watch Netflix, for example, di ba, grabe yung mga bullying that we can see in the States, in the American setting. Mga tinutulak sa locker, binubugbog sa toilet. Okay, so I'm not sure if that happens in your generation now. Okay, so yeah, but that can cause PTSD. That's why if you know someone, sa bagay wala nabubuli ngayon because of the is limited, but what's new now is cyberbullying. You get bullied through social media. So if you can see this happening, or you know that this is happening in a school-related group like your class or in your group, you have to report it to your faculty and clinical instructors, because this has to stop. This is inappropriate. Okay, and yeah, as you know, it can cause PTSD and other anxiety disorders. Okay, so the reality is, when you talk about PTSD, hindi lang soldiers. Okay, it is more often in females because they are more prone. Females are more prone to traumatic experiences like rape, sexual abuse, physical attacks, etc. Okay, pag yung men ang na-physical attack, lalo na pag magkakaibigan pa sila, they will even enjoy it. They will think of it as a memorable event. Naalala mo nung nagkaroon tayo ng, for example, gang war, or for example, napaaway tayo because we were both drunk. Okay, and it becomes a happy, funny memory for them pa. Okay, nakipagsuntukan sila kasi they were both drunk. Okay, but for females, when there are physical attacks, being threatened with a weapon, okay, for if a man or a group of men are threatened with a weapon, it becomes a adrenaline rush. Okay, but for the females, it can be traumatic experience. In men, also, though, the most common traumatizing events, according to statistics, sexual abuse. Even men, especially abroad, are being sexually abused. Common cause also for men, PTSD, combat exposure, childhood neglect, and childhood physical abuse. Okay, so yung mga batang nasosobrahan ng palo, sobrahan ng nabubugbog ng parents. Okay, so those can cause PTSD. Okay, so what pictures of what are flashbacks on your head for the men? Yung mga boys dito sa class now, naalala niyo yung mga times na hinahabol kayo with a walis tingting or a walis tambo or a ruler. Okay, so probably yun yung mga childhood physical abuse na naalala nyo. Okay, it can be a funny experience for you when you think about that, but for those who are experiencing PTSD, okay, it is traumatic for them. Causes: neurologic and biologic factors, biochemical factors. Okay, PTSD can also be caused by abnormal neurotransmitters, your serotonin and glutamate neurotransmitters. PTSD can also be caused by your impaired norepinephrine receptor responses. Okay, so hindi gumagana yung mga receptors ng norepinephrine in your body. In terms of MRI, okay, what happens? There is decreased function of your hippocampus. Hippocampus is the part of your brain that is involved in learning and memory. And your amygdala volume, okay, is either increased or decreased. The amygdala is responsible for processing strong emotions such as fear, pleasure, or anger. So abnormalities in those parts of the brains in terms of size and function can cause PTSD. Risk factors. Okay, so what can lead a person to being high risk for PTSD? Limited social group supports. Okay, so if you do not have groups that can support those soldiers who came from war, those soldiers can develop PTSD. If you do not have, if the parents are not aware that there are organizations that can help their children who were raped, for example, okay, or if the ladies or the men who were sexually abused, he refused to talk to people who can help them about therapy. Okay, so limited supports, okay, they can develop PTSD. Parental neglect. A person who is neglected by the parents can develop PTSD. High levels of anxiety. Okay, so high levels of anxiety means your levels of neurotransmitters are also high. Okay, and eventually, if they remain too high chronically, it can be a risk of you developing mental diseases and such PTSD. Okay, low self-esteem is also a risk factor. Initial severity of reaction to the traumatic event. So if initial reaction to the traumatic event is, for example, the car accident here. If someone experiences for example, the driver who is more experienced in driving, okay, so marami na siyang experiences sa pagmamaneho, although he hasn't been in a car accident and it is his first time, okay, he knows, okay, he knows that this is normal, okay, so what happened is can eventually happen, okay, so probably his level of anxiety during the accident is around 2 or 3, okay, compared to someone, a passenger, for example, a child or a woman, okay, during the traumatic event, he went to a panic level. Okay, so the one who stays, who is at the panic level and stays too long at the panic level, okay, that can lead to a PTSD compared to the other persons who didn't really go to a panic level. Okay, so for example, the driver, since he was only at level 2 or 3 of anxiety, after the car accident, tumaob yung car, he was able to assess himself that, oh, I don't have sugat. Okay, okay ako, I can stand up, I can feel my legs. Then he crawls out of the car, he's able to be mindful, oh, where are my companions, okay, and helping the others come out. So meron siyang, there is still a level of functioning because he's only at level 2 or 3 compared to the passenger who saw blood on his head already and starts having a panic attack. Okay, that person having a panic attack, being hysterical, okay, is more likely to develop the PTSD. History of psychiatric disorders. So genetics na naman. Okay, if your family has PTSD, okay, most likely you will develop it as well. And according to statistics, those who are in a lower socioeconomic status, okay, are more likely to develop PTSD compared to those of the higher socioeconomic status because of siguro longer exposure to stress. Okay, mas mataas yung stress na ine-experience ng lower socioeconomic status compared to those in the higher economic status. Your symptoms of PTSD: numbness, guilt, anger, bad memory, hopelessness, self-destruction. Okay, ito yung mga nagsaslash probably in terms of hygiene. Hindi na rin masyado nag-aalaga ng sarili. Nightmares, low or very low focus. They feel ashamed. Okay, they feel ashamed that they were part of that experience. They feel ashamed that they were raped. They feel ashamed that they were abused. Okay, so ayoko nang maging, what do you call this? I don't want to be with other guys anymore because the other guy may think I am worthless. Insomnia, hallucinations, flashbacks of the event. Okay, violence, substance abuse, irritability. Okay, so in terms of flashbacks and bad memory, okay, sometimes if you talk about the event, okay, they can, some patients can tend to not remember. Okay, so sabihin hindi ko maalala, hindi ko maalala. So once they say hindi ko maalala, you can go back to 2 defense mechanisms. Is it really hindi ko maalala that I don't want to talk about it? Or hindi ko maalala or I don't remember because my memory is blocking it. It is a defense mechanism of your body. I don't want the person to remember it because, okay, it is harmful, it is threatening to the person. So there is blocking, there is denial that it happened. Okay, so there is bad memory. But flashbacks, okay, there can be flashbacks. There can be visions of the event happening at the same time when the person he really doesn't know entirely what happened, but suddenly nagkakaroon ng flashback. The faces of the persons who were there. The people who were shooting his friends, nakikita niya yung pictures in his brain. Okay, so those can be the flashbacks. So violence, okay, the person can be violent. Substance abuse, we talked about that already, and irritable. Physical signs, there can be increased chest pains, okay, headaches, agitation, dizziness, sometimes even fainting. Other signs, your patients can avoid thinking of the trauma. There is blocking and denial. Avoid thinking, avoid talking about the trauma. The patients can be easily frightened or startled. Okay, what do you see in movies? For example, in a restaurant, there was a plate that fell or a spoon that fell. And then the person with PTSD biglang mas startled because he will think that it was a gunshot, etc., etc. There is always a negative mood, negative thinking, always on guard, very cautious, very vigilant. The patient also avoids the places. Ayaw pumunta sa swimming pool, okay, because of the near drowning experience or because he experienced people drowning. Avoiding activities related to the thing that he's afraid of. There is flashbacks. So you can see here the memory of person cannot concentrate. There is aggressive behavior. Okay, loss of interest. In your movies, what do you see? They're aggressive to the person, to other people, because they think that kunwari mag-iiba yung muka. There is a hallucination that this is a Japanese soldier or an enemy, thus you can be aggressive towards it. Okay, or there is just a difficulty to control the temper. That's why the behavior is aggressive. There is loss of interest to everything, activities, life, interaction with others. Okay, ito yung nakita natin kanina, feeling of guilt or shame. Okay, I should have died with them. Yeah, I should have died with my family. I should have died with my teammates in the battlefield. Okay, so why am I alive? Okay, I should have died with them. Substance abuse, so drugs and alcohol, difficulty in sleeping. And when you talk about bad dreams and nightmares, as we said earlier, it is continuous, persistent. Okay, yung hindi lang like us, probably we have nightmares once a year, okay, or when we are very tired. Okay, but for them it is almost all the time. Diagnostic criteria, again, this is for the doctors and physicians, but it is for you to know as well. How will I know if my patient, how will I know that my patient was diagnosed with PTSD? So these are the things that are applicable for my patient with PTSD. There is exposure to actual or threatened death. There is serious injury that was received from the incident, sexual violence in one or more of the following ways. Okay, so direct experience traumatic event, witnessing the events occurred to others, learning that the traumatic event occurred to close family member, the event must have been violent or accidental, experiencing repeated or extreme exposure to adversity, such as first responder collecting the remains, police officers repeatedly exposed to the details of the child abuse. Okay, so they were exposed to this. They did not see the actual death, okay, but they saw the body of the relative being brought out of the house. That can be traumatic already for them. Presence of intrusion symptoms associated with a traumatic event. So recurrent, involuntary, and intrusive memories. Okay, so I don't have to recall. It suddenly just comes back to me. Dreams and flashbacks. Intense psychological and physiological distress in response to cues that symbolize or resemble an aspect of the traumatic event. So I can't even go to the hospital because that is where my relative died, for example. So that is a place that resembles where my relative died. So kahit sa Benguet dyan namatay yung relative ko, kahit sa BGH, ayoko nang pumunta. Persistent avoidance of stimuli associated with the trauma. Ayaw pumunta sa swimming pool, ayaw pumunta sa beach, ayaw sumakay ng taxi, ayaw sumakay ng kotse. Negative alterations in cognition and mood associated with the traumatic event. So once he is exposed with the trigger, there is an inability to recall important aspects of the trauma because there is blocking. The body or the brain is blocking these memories because it is harmful to the patient. Marked diminished interest or participation in activities. Your person doesn't want to socialize, go out, join friends. There is feeling of detachment from others. Okay, so separating self. Marked alterations in arousal and reactivity evidenced by two or more of the following. Difficulty of staying asleep. Okay, so staying asleep. People have difficulty of staying asleep when most of us, okay, have a difficulty of being wakened early in the morning. Reckless or self-destructive behavior, irritability, difficulty concentrating, hypervigilance, exaggerated startle response. So magugulatin. Okay, they can easily be scared or startled. Treatment. Okay, so the key treatment according to the researches, my books and references, the main treatment is CBT. Okay, cognitive behavioral therapy. It is learned. So behavior is learned. Okay, and actions also have reasons. Okay, so non-pharmacologic. So our treatment is divided into non-pharmacologic and pharmacologic treatment. So interoceptive exposure is basically stimulating. Okay, so some in interoceptive exposure, we remind the person of the traumatic event. So once we remind the person of the traumatic event, okay, all the physiologic symptoms come out. So kinakabahan siya, there is muscle tension, there is anxiety, and when those symptoms are triggered, okay, it is like placing the person in the actual event. So when the person is feeling like when he was during the actual event, if we talk to him about it, okay, he will be able to really give more information and express more of his thoughts and concerns about the event. Okay, so there are thoughts that there are accessed when we put him into a interoceptive exposure state. Okay, kaya siya nilalagay. That's why he's being introduced. Compared to when he is calm, compared to when he is not in the PTSD state. Okay, so iba yung thought setting niya, body setting niya. So we want him to be in the state of anxiety. Then the therapist will talk to him. Desensitization, gradual introduction to the area, okay, where he feels stressed. Okay, so kung it is the water, okay, that reminds him of the drowning, so slowly we introduce him to the swimming pool, to the beach, so slowly or gradual introduction to the traumatic place. Non-pharmacologic treatment will include relaxation techniques, or deep breathing, massage, visualization. Okay, psychotherapy is also important, talk therapy, and your group therapy. Okay, group therapy, one of the goals of group therapy is to make him realize that he's not alone. There are other people going through the same experience. So you put them in a group therapy with other soldiers. Okay, kasi being with people who know or understand you really, okay, can help you. So, and as I said, CBT. Sa group therapy, for example, lahat sila were sexually abused. Lahat sila were in a gang war. Lahat sila had the traumatic experience when it comes to police assaults, for example. Okay, so they can easily talk about it kasi sila. Being in a group that has experienced the same thing that you experienced, okay, makes you feel at ease talking about it. But again, for PTSD and for our phobias, the main treatment is CBT. So what I need to know about CBT? Cognitive behavioral therapy, guide to help people experience experiencing mental health problems. CBT focuses on the present day challenges, thoughts and behaviors of the person. So we focus on the behaviors and thoughts that are really disturbing to the person. Time limited, and person will be aware when it will end. So part of your guidelines, how long will the session last? How many sessions will we be having? And anticipation of the patient. 1 hour lang to. Okay, so it collaborative with the relatives, collaborative with the patient and the healthcare worker. What else do you need to know about CBT? Psychotherapy that focuses on how a person's thought, beliefs, and attitudes affects the feelings and behavior. So let him know that everything that he is feeling and everything that he is displaying is because of what is he thinking, and what is he thinking is based on what his experience, what the experience was. CBT offers support with people suffering from mental health condition. What will you learn from CBT? They identify and distinguish negative and positive thoughts. So ito is the goal of CBT. What are the negative thoughts that the patient is feeling? So list them all out and see, ito yung mga iniisip mo. These are the things that are preoccupying your head. And then list down positive thoughts. What are the positive thoughts that calm you? Okay, and the goal is to replace the negative thoughts with the positive thoughts. Develop positive perspectives. Okay, so something bad happened in the future. Okay, that is something that we cannot change. But what else can we do now okay, so that the future will become better. Okay, what are the positive things that we can look forward to in the future? CBT also gives you awareness of yourself. Okay, the past, okay, that made you, okay, you can be aware of that. Your strength and your weaknesses also can be put into spotlight through your CBT. Okay. It can be, a CBT can be done through one-on-one or in group session. It can be done by exposure to the things that cause the fear. CBT can be done by feedback and positive outlook on skills and potentials. Okay. CBT treats depression, stress, phobia, anger, and panic disorders. How CBT works? Okay, the therapist and the session focuses on present thoughts and beliefs. CBT causes awareness how thoughts affects behavior. Okay, so if the patient highlights, or the therapist highlights that if we change your thoughts, we can change your behaviors as well. Because what is the problem of being exhibited? And so we highlight to the patient that if we change your thoughts, your behaviors that you're exhibiting that you don't like, you fighting others, you not being able to take care of yourself and your family, mapapalitan lahat yan if we change your thoughts. Challenging and comparing thoughts. Okay, so how do we do the challenging? I showed you an example in the previous video. In GAD and anxiety disorders, you have to present reality to the patient. Okay, for example, how can that spider be present? Okay, how can you be how can you be threatened by that spider? Okay, when that spider is not present in the Philippines. Okay, so those are challenging. Challenging your patient. What else? The war is over. For example, in the Philippines, the Spaniards are not here anymore. Okay, how can there be another war? Okay, we are not in war with another country. China, okay, basically is not really that interested in going into war with us. Okay, although they are interested in our seas, for example, but it comes to really a threatening war, it won't happen with China currently. So what is it, okay, about the war that you are afraid of? Okay, so encourages changes of thinking. Okay, that is the goal of CBT. Who facilitates CBT? Most likely the psychologist and the physician. Okay, but we are able to co-facilitate because we are part of the health team. If you do not, if you have your non-pharmacological, your therapy, you also have your pharmacologic treatment. And for PTSD, you have your SSRIs and SNRIs. Okay, so these are the medications. Zoloft, Prozac, Cymbalta. Okay, these are the famous brands, okay, that you will encounter. You also have your second line medications, which are your antidepressants, your MAWIs, monoamine oxidase inhibitors. Okay, you have your anxiolytics that help with the anxiety, and your alpha adrenergic receptor blockers. Okay, those are the things that are given to your patients with PTSD. Suicide risk for patients with PTSD. Okay, traumatic events such as sexual abuse can increase the person in attempting suicide, of course. Okay, there are a lot of reasons. Shame, there can be a feeling of worthlessness. Okay, wala na akong kwenta, so I'd rather commit suicide. Or fear of it happening again. I don't want to be raped again. I don't want to experience war again. I don't want to, or I want to be with my family already, so I'd rather commit suicide. Okay. Other comorbidities that happen with people with PTSD, of course, aside from suicide, risk for suicide or attempted suicide or successful suicide, other things that can harm a person with CBD in terms of statistics, they develop viral hepatitis because they tend not to take care of their health already. Okay, so nagkakaroon sila ng hepatitis, and also the stress toxins that they are keeping in their body causes the viral hepatitis. Chronic liver disease. Why? Because of alcoholism. Okay, so they start to have liver cirrhosis because of the alcoholism. Diabetes mellitus because of the diet. Okay, they don't eat properly already, or they tend to binge. Okay, there is not a balanced diet because of their they tend to release their frustrations by eating. Okay, so and they can develop diabetes mellitus. Accidental injury can be caused by your lack of focus. Okay, so hindi makafocus ng maayos while working. So what happens? The person can have lack of concentration while driving, lack of concentration while working, lack of concentration while crossing the street. Okay, while cycling, etc., or whatever activity. So it can cause accidental injury. While cooking, for example, then the patient has a flashback kasi may hawak siyang knife. Okay, pwedeng makat niya yung sarili niya. Okay, so those are other mortalities and morbidities when it comes to PTSD. And of course, as nurses, what are our nursing interventions for our patients with PTSD? A patient with a history of trauma may be suspicious to others in his care and his environment. Okay, so he is suspicious, he is paranoid. Okay, so work to establish a trusting relationship and build rapport with your patient. Make sure that your patient is able to trust you. Okay, talk to your patient calmly. Okay? If possible, assign the same healthcare providers. Okay, so that the patient doesn't have to keep on adjusting. The patient doesn't have to keep on introducing himself, talking about the same things over and over. Okay, so the conversation can progress. Okay, if you can assign the same healthcare providers. Okay. Promote an attitude of openness and acceptance, because especially those who are having what do you call that, the feeling that I should have died already with them. So give them personal acceptance. Okay? Don't judge them. Let them feel that they can be comfortable with you, and that you are not what do you call this, you are not judging them. Stay with the patient during the flashback and nightmares. The patient may need reassurance from a trusted person that she is not going crazy. Okay, so recognize that that is a flashback of what happened. Okay, so calm your patient. Okay, so remind him that you're having nightmares because you're experiencing PTSD. Assure him that he is not going crazy, but these are normal symptoms. These are symptoms accompanied with the traumatic experience that he experienced. Encourage the patient to express his or her grief. Complete the mourning process. Okay, so you go to your DABDA, sorry, and we'll discuss that later. Yung DABDA nyo, okay. Your normal grieving process, denial, anger, bargaining, and then depression, and then acceptance. That will be a normal process, the normal grieving process. Teach relaxation techniques or deep breathing, visualization. Okay. Reassure the patient of his ability to return to a previous level of functioning. Okay. So assure him that he will be able to function properly, that he is not stuck in this state of negativity. Okay. And that if we go through the therapy sessions, if we are religious with the medications, if he continues to be open, okay, is that he will be able to function better in the future. Okay, that will be the goal. Okay, for example, you present to him the goals that you would like to target during the nurse-patient relationship, or your interactions or therapy during the confinement of the patient. So if you present him with the goals, there is something that he can look forward to in the future that can increase his participation with the interventions. Use crisis interventions techniques as needed. So kung nagwawala yung patient, okay, what are the appropriate, okay, crisis interventions? Your patient will also undergo anger adjustment. Okay, so your nursing interventions for anger adjustment, okay, deal constructively with the patient's display of anger. Help the patient assess, okay, the angry outbursts, not when it is the peak of the anger. When your patient becomes calm already. So talk to him about it. Okay, you had an anger outburst earlier. Okay, so how do you feel about it? Were you able to release your stress about it? What triggered it? Okay, so assess and help facilitate the analysis of the anger outburst with your patient. Identify how the anger escalates. Okay, what further triggered it? What further increased it? What mellowed down? Kumalba ba siya nung nilapitan siya nung familiar nurse? Did he calm down when he was given his space? Okay, do we put him in his own room? Can we assist him in his own room? Okay, let's go first to your room. okay, so that you can calm down. Did that de-escalate him? Okay, and help him identify that. So that the next time the patient can know what he is doing also. Help the patient regain control over angry impulses by identifying situations in which the patient lost control and by talking about past events. Okay, so more on talk therapy, and the goal of the talk therapy is to empower the patient. So every time that happens, nagagalit ka. So the patient will try to avoid those situations as well. Provide a safe, staff-monitored room where the patient can safely deal with urges to commit physical violence or self-abuse. Okay, so when the patient is being upset already, pwede ba natin siyang ilagay sa padded area? Okay, or where he can punch, okay, the paddings, or kahit sumigaw-sigaw siya doon. Okay, so he can do that. Encourage the individual to move from physical to verbal anger. So instead of hurting the other people, let him express his thoughts. Okay? Use a direct, non-judgmental approach in discussing suicide. Okay, so the best example that we saw is introducing the topic with the patient. Okay? I know this is hard to talk about, but I just need to ask the hard question already. Have you ever thought of attempting suicide? Okay, so yun yung isa natutunan natin in one of the videos. During your PTSD treatment, there will be perspective correctives. Okay, it means that we are going to correct the thought and thinking and perceptions of your patients. So what is the nurse's obligation here? We will help the patient alleviate shame and guilt precipitated by real actions. Okay, so help the patient understand that, for example, he is not, hindi niya kasalanan. The war was not his fault. It was not his fault that she was raped. It was not his fault that he was abused by the father or the mother. Okay, so redirect. It is the fault of the father. It is the fault because understanding the father. When your father was also young, he was also abused. So he thought that that was the right way to raise you. That's why you were hit or you were spanked or you were beaten up, because that is also how he was raised. Okay, and it is not your fault. Help the patient put his behavior into his own perspective, recognizing isolation and self-destructive behavior as a form of acceptance and forgiveness. Okay, so there are things that he can do to forgive himself. Okay, there are things that he can do to further improve the situation in the future. Carefully review the healing process with the patient. Remind the patient not to equate setbacks as failure. So it's okay that you had a bad day today. It's okay na it's not really okay that you punched another patient, okay, but you haven't punched or gotten angry with another patient for how many? 7 days already. So that's an improvement. Okay, so slowly we are improving your agitations already and your violence towards others. Okay, so we'll try harder again for the next 7 to 10 days. So don't sulk yourself into that error that the mistake that you did today. And yung mga tipong equate setbacks as failure. Other treatments will include medications. Okay, nursing interventions. So administer medications as prescribed. Teach patients about the prescribed medications and adverse effects. Okay, the target of the medication is to lessen your anxiety and anger. But if you feel that it further triggers you, okay, let me know and we will inform the doctor. Evaluate the patient's response to the drug and drug regimen. Okay, is the patient continuously taking his medication? If the order is twice a day and he has already been discharged from the mental institution, is he still taking it twice a day? Beware that benzodiazepines are fast-acting, okay, but can lose their effectiveness due to prolonged use. Okay, so this is already the weakening of the medication because the body is getting used to it already. So let the patient know that the adjustments can be done with the medication. If you feel that the medication is not being effective already, inform me so that I can inform the doctor if there is a need. The doctor will reassess you if there is a need to increase the medication or change to another medication. because there is a feeling of guilt, survival guilt, okay, there are things that you can do. For example, you can refer to the clergy or community resources. So for example, i-refer mo sa pare, okay, so that the person can do his confession, okay, because he killed a lot of people during the war, and hoping and feeling that what he will be able to forgive himself kasi napatawad siya ng priest. For example, he was able to verbalize with the priest. Encourage the patient to do community resources. What are the other groups where he can talk? Okay, I searched the internet, marami. You still have apps, okay, of treatment groups that he can be part of. Refer to group therapy with other victims for peer support and for forgiveness. Okay, so because there is a big feeling of self-guilt for PTSD, especially those who committed violent crimes. Okay, that's it for the PTSD slides. I will go to one video, last video, and then that's it for our PTSD for today. Please stand by.
Many of us will experience some kind of trauma during our lifetime. Sometimes we escape with no long-term effects, but for millions like everyday life. This phenomenon isn't a person's biological mechanisms. Two processes are domestic violate, events, brain's alarm system. When this alarm sounds, the autonomic nervous system, internal and respiration, with several prepare the body to and muscles related levels of stress, nightmares, and other here within a few days to 2% of those who is vanishing temporarily, only to what's happening in the brain, continuously activating brain functioning, often fall into focus, avoid fear, anger, and difficulty, or last more than a month. Ongoing pre-existing role in underlying cause major triggers, physical trauma, dangerous. For example, trapped in a memory event. That's as if they're trying to lead to isolation. It's understood, like a news around them. But PTSD, the first step towards the many PTSD, helpifications can make symptoms of illness and regular a friend or family need to helping and recovery, and that you don't blame them to seek evaluation. Hidden wound because it is an invisible. Mental health conditions impact. Check out.
Okay, so for today, we were able to discuss first, which is your phobias and PTSD. We focused on assessing them. What are the behaviors? What causes them? What are the treatments? And for treatment, the key treatment for both disorders that we have discussed today is basically CBT, cognitive behavioral treatment, and also for our nursing interventions. What can we do as nurses to our patients who have PTSD? Okay, so a lot of talk therapy, being able to let them express their emotions, train them, okay, with techniques to help them alleviate the symptoms, positive thinking, deep breathing exercises, also for visualizing, okay, yung mga ginagawa natin. Okay? And acceptance. Acceptance both on the part of the patient that he is in need of treatment, he is in need of changes in his thinking and behavior, and also acceptance in our part that there are things we can do to improve or help our patients. Okay, that is phobias and post-traumatic stress disorders. I am targeting 2 more diseases that I will be sending you through another video link later. So I will be recording another video that you can watch on your own time. I hope that you have watched already the video on GAD and anxiety disorders. Para matapos natin yung lahat ng diseases that we need to cover for midterms. Okay, so probably another 2 more diseases, then I will decide if we will push through with our midterm exams. Okay, so that's it for today. Enjoy your Saturday, enjoy your Sunday, and I don't know if you have duties on Monday, but as I said, your what do you call this? Your self-awareness workshop will be on 7, 8, and 9, and more details and announcements will be given to you as the faculty will finalize the activity. Okay, thank you for listening. If you have questions, feel free to message me. Good morning and have a nice day to everyone. God bless.
Thank you, sir.
Thank you, sir.
Thank you, sir.